Hi, my name is Nick Clavin. I'm a plastic and reconstructive surgeon here at Atrium Health, Levine Cancer Institute. Plastic and reconstructive surgeons are intimately involved with the restoration of women after the impact of breast cancer, especially from a surgical perspective. So we take part in restoring breasts using a variety of different modalities, using autologous tissue, our patient's own tissue, and using implant-based reconstruction, and a lot of crossover between those two topics. So the timing of breast reconstruction will often vary based on the patient's cancer treatment. More often than not, we're trying to do immediate breast reconstruction, which means that on the same day when a patient is undergoing a mastectomy, we're at least initiating a portion of breast reconstruction. There are also options for delayed reconstruction, meaning anytime down the line when a patient has already had a mastectomy, we can also perform breast reconstruction. So all timing is available, but more and more we're trying to do as much as we can during the initial procedure where they're having their breast cancer surgery. One of the most common questions I get as a plastic and reconstructive surgeon from younger patients is, how is this going to impact me as a woman, and how is this going to impact me as a mother? And these are certainly things that we take into consideration when it comes to reconstruction. Things like the abdominal donor site, and if we're going to be able to perform a transfer of tissue from the abdomen to the chest to perform a breast reconstruction may not be always the best option when a patient is younger or is in childbearing age. So we take that into consideration. We also take into consideration a patient's activity level. More and more we're putting breast implants and reconstruction in front of the pectoralis muscle instead of behind it, because we find that the discomfort associated with stretching the muscle and activity level in our patients both are impacted by that, especially in younger patients. What we can accomplish as plastic and reconstructive surgeons really transcends surgical technique, because what we're ultimately trying to do is assist in helping our patients return to a sense of wholeness and a sense of self. This isn't something that happens necessarily in one surgery or one follow-up. Patients will see throughout their entire lifetime, if we can. I see my patients annually after all surgeries, and there's changes that they see in their body during that time, and we try to help with modifications or adjustments to any surgical procedure to try to help with that return to self.